and a goal and a pledge that if you have a single business permit in Nairobi, one of the things I said, we will use a single business permit as an incentive tool for minimum wage. It will also be an incentive tool for NHIF recruitment, including for house girls, house helps, or what we call domestic house managers. Give them NHIF, because if all of us contribute, then we have a tool. What I've spoken to is a barrier, so access to hospital insurance is key in the city of Nairobi. And it doesn't matter whether you're in formal employment or informal employment. We as a government will look for incentives. We have the mechanisms to be able to build that. But we will also want to ask the global NHIF, which is under the national government, to really look at it. Our hospitals, that cash that is going to private, and by the way, what I have said is factual. Download the latest payments, the last 90 days by NHIF to whichever institutions, and you will see what I mean. And I think NHIF also needs to work with county governments. I'm going to be very active in recruiting Kenyans who live in Nairobi to the hospital insurance fund. I think it's a wonderful thing. Of course, it has normal challenges of running an institution, but they're not insurmountable challenges. And private hospitals must go to the back line. This is public. At the end of the day, healthcare, education, security, water, data, electricity, these things are public goods. Nothing has changed from economics 101. There's public goods and there's private goods. They are goods that are best delivered by a government. And health is one of them. And also the doctor, not just the doctor, the nurse, the radiologist, the lab technician. We have this idea that hospitals is buildings. The same way a hotel is not a building. If this hotel did not have very good food, drink, waiters, clean cups, then it's not a hotel. But our hospitals and our dispensaries must be available. Then 24 hours. You know, today our dispensaries are working, I think 6 hours or 8 hours. They really need to be opened under my leadership. Nairobi dispensaries and public health care centers will work 24 hours. I grew up in a city where all my immunization I got from a Nairobi City County nurse. I went there, and if my mother didn't take me back, you know, I remember the Kasarani one, which was very popular and would take care of malaria. And we would line up and we would get our immunization. We would get our deworming tablets. The nurse knew the community around it because there's Nyumba Kumi structure, there's a ward development, and the public healthcare system was good. That's why we are resilient as we are, and thank God in terms of our health. So healthcare is both a software issue and a hardware issue, but we have paid too much attention to the hardware issue. We have forgotten the software issue, and the software issue is taking care of you as a doctor, making sure you have a good career, you as a healthcare worker, whether you're high, and not just, and even non-teaching staff in hospitals. I would like after 5 years to start to see more Nairobians go to public health system than the private health system. It seems we have undermined the public health system so that the private health system can go up, and it's too expensive, and the services in the private health system are also become very poor. You go in there, the triage is not done well. You know, they're also collapsing under their own weight. It's the same problem we did with public transport. We killed public transport for private transport. Today I've shown you government has gone back to the railway, and I've shown you big neighborhoods where people have moved. Public service is what really creates sustainable long-term value, and we will bring back decent public services to the people of Nairobi as far as education, health is concerned, security too. Thank you.
Thank you. And actually, just to point on that, I think it was raised a while back regarding NHIF. For those of us who can afford to pay, should pay more. Because I think a lot of us pay this around about the same 1,400, 1,600, and it should be equivalent to what we earn.
And I'll tell you, in the private sector, majority of us in this room don't even know whether NHIF exists. We go to Bupa, we go to private healthcare insurance. The hospital insurance fund, you should get it when you're getting your ID card, in my view. You should be recruited when you become of age, when you're 18. You should be recruited perhaps even when you go to university to go to the hospital insurance fund. But there's something wrong with that insurance fund in Kenya. It has been captured by corruption. When I see the 5 top hospitals whose invoices are attended to the fastest in Upper Hill at NHIF headquarters, it sends a very big signal that it's been captured. But this capture of institutions, this capture of counties, this capture of the government comes to an end on 9th of August. Because when I listen to Kenyans, the silent majority, because there is a big silent majority who are even not read in polls, they will surprise our competitors. Because for the first time ever, I've never seen a beautiful country like this. For the first time ever, I can tell you, anybody who does dodgy business is our competitor politically. I've never seen like this. It's beautiful. Anybody